it's so exciting because for a long time, you and I would fight against that philosophy. We'd say, no, we got phase one. We can get them out of pain.
Right.
But, after a couple of weeks of me sticking needles in them or you adjusting them or the physical therapist, we realized that there is some power in using some modern medicine. And, I had to get over my ego with it. And I had to realize, okay, I think there's a right way to do it and a wrong way. And I love the knowledge that our doctors have in the surgical center because they are so skilled. They can get right into the area that they need to go. And maybe you could talk about some of the technology that they use and why it increases safety and effectiveness.
Yeah. It's interesting. I was just having a conversation with our medical director yesterday, and we were kind of laughing. And he says, I was a little skeptical when I first came in because this isn't traditional. This is, and he goes, the results that I see with what you are doing in your facilities blows me away. It's like nothing I've ever seen before. And this is so incredible and so fun to be a part of because he now realizes that the medication that the medical world has been handing out and giving patients, is not, it's not an end to treatment. It's just a cover up. So really what we do with our patients, if they need that type of care, we have the ability to send them in the safest environment that we can. Patient safety and even staff safety is critical.
Yeah.
And, when we're dealing with, getting into these deep areas of the spine, getting into the epidural space, getting around the disc that's swollen and inflamed, or getting into the knee joint, one of the biggest risks, of course, is infection.
Yeah.
We want to be able to control that infection because if we create an infection by injecting or doing something in a place that doesn't, it's just not the safest environment. It's not the most sanitary environment. All the regulations are there in our facility to put somebody in the safest place. We have monitored anesthesia care. I mean, the patient's in the safest place, the doctor is in the safest place, the staff is, but we can go in under video fluoroscopy, which is a video x-ray, guided ultrasound, and we can really get into those areas and specifically get needles right next to the damaged area, that tissue, and deliver the small doses of medication that we need to without creating a big problem and side effects. We want to use small doses. So we want to pinpoint it. We want to get right in there. And we use the latest visualizing techniques to get in there and deliver that medication, reduce that inflammation, and get a patient out of pain as quickly as possible.
Yeah, when I first experienced it, touring the facility and looking at everything that's going on, I said, this is incredible because, and I mentioned to you, I said, it's so relaxed. The environment is just very, very comforting, very relaxing. There's not the high pressure that you would imagine. It is a very peaceful, safe feeling place.
Yeah, so what it is, it's an ambulatory surgical center. We hear the word surgical center, we think, what kind of surgery is going there? But really what it is an ambulatory surgical center is just an in and out a patient facility that a patient doesn't have to spend the night. It's a same day procedure.
Yep.
So we can really do a lot of procedures there, all the way to, there are some, for the elderly population that has stenosis, there are some procedures that can actually open that stenosis up. That is a minor surgery. But primarily we're doing injections and ablations and things to reduce that pain and inflammation very quickly for a patient, and give them the chances I've mentioned before to really begin now to rehab. So it is a chill place. It's not stressful. In fact, patients are in there just having a ball. We have music playing, and it's just an atmosphere of healing is what we want. So.
Yeah, and it's a portal. We can shave off about 6 months of time for that patient, 6 months of suffering, and we can get them the end result, which is permanent pain relief because of this phase one. And so let's talk about a couple other things that are going on there. One is the nerve reset. And then the other one is the manipulation under anesthesia. Those are fascinating procedures that I just like. I love. I love the results. It's innovative. It's really powerful.
Yeah. So, the nerve reset, which is really, it's an ablation of the nerve. What we're trying to do is go into the facet joints. So patients that have facet arthritis, and they've had it for years. We can adjust them, we can stick them with acupuncture needles, but we're dealing at a deep level with facet arthritis, which is so common and can be a very, very debilitating thing and very difficult to overcome for patients. And so really what we want to do is get the process to a level where we can begin to regenerate it, strengthen it, get in. And really one of the key things with our practice is restoring function, restoring the normal lordotic curves and coupled motion. And that's part of the physical therapy coupled with our chiropractic. It's specific types of physical therapy. But when you have a lot of arthritis there, it's really hard to overcome that. So, traditionally, interventional pain doctors will go in and do what's called a nerve ablation. They'll go in and actually, hit the nerve and actually knock it out for a period of 6 months to 9 months. But then it comes back. The nerve, comes back. It resets and it's firing again. But that's their end all. That's the treatment, and that treatment alone, so many patients that come in, I've had that treatment, it didn't work. And I asked them, so did you get some pain relief? And they said, well, yeah, I felt good for about 6 months and it just came back. I'm like, exactly. So again, we're going to reset the nerve with an ablation, but now you're going to start the rehab process. You're not going to that's not the end treatment. So we're going to go into the phase 2 is we're going to talk about now the rebuilding and retraining of the tissues. And then the final phase is the regenerative process. And what does that take? So again, we use those as just an end all. But then again, as we go into the MUAs or the manipulation under anesthesia, as I took all of our doctors to that training, I'm like, I'm gonna get treated, doggone it. So I got treated at the training, and I'm 54 years old. And I'm gonna tell you right now, I felt at least 20 years younger. It was amazing. So we have the ability, if anybody's ever been to a chiropractor, they've been in and they're trying to get adjusted, and you're so stiff and tight, or the pain is so acute, it's almost impossible to get done what we need to do. So if we can put you out with a very it's a very, very mild sedative that we put you out, you wake up and it's like you have an incredible nap. Mm-hmm. And we can go in and manipulate the joints without any resistance. So, I have a patient who's a bodybuilder, and he's got so much adhesions in his elbow. And if I try to adjust or move his elbow, I think he's going to punch me. He's going to knock me out. He's big. He's a big boy. Yeah. And, we've gotten in there and we've tried to do acupuncture. We've tried to get in and massage the muscle, and it's just so painful for him. And so we put him out and got in, and we got in there and just worked that elbow. And he woke up and he's like, I want to have this done every month. I want this every month for the rest of my life. That was the best thing anybody's ever done to me.